boundary crossing, dual relationships, and bartering, an argument for action. Psychological professionals are told you have a right to be paid and to avoid risk at all costs. This advice overrides a client's right to treatment. What happens when a client loses their job? What happens when a potential client cannot afford to start therapy? What happens when a client is too proud to accept pro bono work? The current responses to these questions are answered through a risk management model which keeps the therapist safe from repercussions and complaints. For the past few decades, therapists have acted specifically to reduce likelihood of potential consequences from professional organizations instead of doing what is in the best interest of clients. You've read the paper which held undesirable view of bartering and dual relationships in therapy. It's the same argument we have been exposed to in class. This presentation will discuss the differences between boundary violations and crossings, how dual relationships can benefit the therapeutic relationship, and how it relates to alternative payment methods with a special focus on bartering. These two polarities represent deontological ethics and utilitarian or situational ethics. You could also label these arguments as one between absolutists and relativists. An absolutist believes that certain actions are ethically right or wrong and that certain values should always determine the moral course of action. A relativist believes that moral standards are personal, subjective, and situational. The morality of a decision is measured by the goodness of the outcome. The deontological view focuses on process. The utilitarian view emphasizes outcome. An absolutist might argue that there should be no blurring of roles because there is a foreseeable risk of exploitation. A relativist might argue that it is a win-win situation. There is a difference between a boundary crossing and a boundary violation in therapy. Boundary violations are almost exclusively exploitative, illegal, cross the line of decency, and are always unethical. An example of a boundary violation is a therapist being involved in a sexual relationship with a client or the clients being physically or verbally abusive. Boundary crossings on the other hand are a deviation from a therapist's professional code and risk management procedures. Examples of boundary crossings can be demonstrated from standard practices in several different sects and psychology such as, in vivo desensitization, appropriate self-disclosure, lunch with an anorexic patient, a home visit for a sick or dying client, attending a client's wedding, or a well-structured bartering arrangement. Time boundaries are crossed when a client is unwilling to leave or requests phone and email sessions in between scheduled sessions. Nearly 40% of therapists are flexible about the start and end time of a session. They are, however, consistent with the length they last. Money is also a boundary in the therapeutic relationship and it can be crossed or violated. Alternative payment methods or fee schedules, third-party payment, and reduced or no-fee sessions are all boundary crossings as they cross the standard, full-fee arrangement. Additionally, using a collection agency to collect unpaid fees is a boundary crossing. Although commonly used, third-party payment from an insurance company is also a boundary concern. It is crossed due to who can have access to the client's file, or assessment results, after payment is received. What can be seen from these common boundary crossings is that deviation from the standard is not necessarily unethical. When considering crossing boundaries, a therapist needs to assess the appropriateness according to the exact context of therapy the client is in at that time. Factors include the client's and therapist's cultures, history, age, gender, health, economic class, and mental state, whether the setting is private or group practice or if the patient is inpatient versus outpatient, and the modality, longevity, and intensity of therapy. There is a fear of boundary crossings becoming dual relationships. Dual relationships, which can be unavoidable, are still stigmatized with the slippery slope argument. There is a belief in the psychological community that if a therapist crosses any line regardless of the reason, disaster will follow, and the relationship between the therapist and client will be detrimentally altered, permanently. I find this black and white thinking to be too rigid for real life. Are dual relationships avoidable or unavoidable? There are many types of dual relationships which can include social, professional, business, communal, institutional, forensic, supervisory, and online or internet-based. These relationships can often be avoidable in large cities where there are many places to shop, worship, and engage in recreational activities. However, sometimes dual relationships take place due to situations out of the therapist's control. For instance, being in a rural location or if the counseling is mandated. Additionally, sometimes, dual relationships can occur and be unexpected, such as when a new client ends up being the co-worker of another client. These types of relationships can occur concurrent with therapy, after therapy has terminated, and can vary in their level of involvement. Levels of association can fluctuate from bumping into each other at the grocery store, to attending the same religious organization, to serving on the same committee as each other, such as one for LGBT rights. Many factions in the psychological community do not vilify dual relationships. Many therapeutic approaches such as behavior, cognitive, humanistic, and existential therapy will, at times, use dual relationships as part of the treatment plan. Slowly, professional organizations are becoming flexible with the rules about dual relationships. The Canadian Counselling and Psychotherapy Association, 2007. Counselors make every effort to avoid dual relationships with clients that could impair professional judgment or increase the risk of harm to clients. Examples of dual relationships include, but are not limited to, familial, social, financial, business, or close personal relationships. When a dual relationship cannot be avoided, counselors take appropriate professional precautions such as role clarification, informed consent, consultation, and documentation to ensure that judgment is not impaired and no exploitation occurs. Canadian Psychological Association, 2016. As public trust in the discipline of psychology includes trusting that psychologists will act in ways that promote the dignity, well-being and best interests of members of the public, situations that present real or potential conflicts of interest are of concern to psychologists. Conflict of interest situations are those that can lead to distorted judgment and can motivate psychologists to act in ways that meet their own personal, social, political, financial, or business interests at the expense of the dignity, well-being or best interests of members of the public. Although avoidance of all conflicts of interest is not possible, some are of such a high risk to protecting the dignity, well-being or best interests of members of the public and to maintaining the trust of the public, that they are considered never acceptable. The risk level and acceptability of other conflicts of interest might be partially dependent on cultural or geographic factors and the specific type of professional relationship. In some situations, for instance, a dual or multiple relationship might be inevitable or culturally expected, or could enhance the benefit of an activity. However, in all such situations, the psychologist is responsible for making an honest appraisal of the benefits and risks involved in the context of the specific situation, including but not limited to, determining the feasibility of alternatives in light of those risks and benefits, deciding whether to enter into or continue the relationship, establishing relationship boundaries appropriate to the work being done, and managing the relationship to ensure that the dignity, well-being and best interests of the members of the public are protected. As a whole, these organizations, among others, write their code to follow these main principles. Sexual dual relationships are always unethical with present clients. Non-sexual dual relationships are not always avoidable. Non-sexual dual relationships are not always unethical. Therapists must avoid dual relationships which might impair their own judgment and objectivity, interfere with how effective the therapist can perform therapy or supervision, harm or exploit clients. How does this relate to bartering as an alternative payment method? As discussed previously, each payment method which is not full-scale is an accepted type boundary crossing. In spite of this, when discussing bartering, a system of exchanging goods or services, an arrangement older than money, gold and silver, a line is drawn in the figurative sand. Risk management intensifies. Guthale and Gabbard expressed in the article you read that bartering is both confusing and ill-advised. Nevertheless, bartering is especially common in rural or agriculture communities, with certain ethnic cultures, and in times of economic depression. One advantage of bartering that is rarely discussed is the increase in privacy compared with those who use third-party sources. Like with those who pay out of pocket, clients who barter in place of insurance billing have greater control of who accesses their information, and do not have to worry about limited coverage or denial of claims. There are several types of bartering arrangements, each with their own benefits and complexities. The main types are listed in here. A therapist should be very careful when determining valuation for their services, especially if their hourly rate is substantially higher than the client's. Not all bartering arrangements are dual relationships. In many cases for direct trades of goods, the item being bartered is simply substituting for cash. This does not alter the therapeutic at all. It may, however, strengthen the relationship between the client and professional. Most professional organizations prefer therapists to barter with goods due to its less complex manner. When bartering for services, the therapist should spend a great deal of time discussing and explaining the intricacies of such an arrangement with the client, ensure they understand, and put it in writing. Although creating contracts is not necessary, it is good practice for all bartering arrangements. What is more, bartering arrangements do not need to be long-term, nor do they have to be due to financial difficulties. An illustration of this is provided by Officer where a previous client felt she was cursed by money. She had never needed to work and spent her days shopping. She used money to buy love and get what she wanted. Therapy was not yielding any significant results, so Dr. discussed the client's relationship with money. She felt she paid for Dr.'s love and care, so they decided that for 2 months she would contribute 4 hours at the local battered women's shelter for 1 hour of therapy. This arrangement was a turning point for the client's therapy, and in her life. In prior ethical codes, bartering was forbidden. Presently, the method is accepted in many organizational codes, although, in some, it is still discouraged. Canadian Psychological Association, 2000. Establish fees that are fair in light of the time, energy, and knowledge of the psychologist and any associates or employees, and in light of the market value of the product or service. Canadian Psychological Association, 2016. Not exploit any relationship established as a psychologist to further personal, political, or business interests at the expense of the dignity or well-being of their primary clients, contract examinees, research participants, students, trainees, employers, or others. This includes, but is not limited to, entering into fee arrangements that are clinically or culturally contraindicated, allowing the financial advantages of method or communication modality choices to outweigh the dignity, well-being or best interests of primary clients or contract examinees. College of Registered Psychotherapists of Ontario, 2014. A member is permitted to barter her services with a client who cannot afford to pay, if certain conditions are respected. The services provided by the member are of equal or greater value than the item or service being exchanged. The bartering arrangement would not be seen to affect the member's judgment. The arrangement would not adversely affect the client's confidence in the member, and The arrangement is clearly spelled out and agreed to before therapy commences or continues. Members should be aware that bartering could trigger tax consequences, and should consult with their tax professional to ensure they are in compliance with all provincial and federal laws. Tip: the main principle of the above code of ethics is to avoid exploitation of the client. In order to do this, one must make an ethical, rational, and impartial decision on what is best for the client. Before entering any arrangement with a client, the therapist needs to assess whether doing so is in fact appropriate for the client. Bartering is not a payment method suitable for everyone, such as those with borderline personality disorder or those who are highly paranoid or suspicious. A failed arrangement can devastate the therapeutic alliance. Thus, while preparing for such an agreement, all aspects should be assessed methodically. All parties must be happy with the arrangement and the risks must be known and understood. Carefully written records can help with any potential complications in the future. When devising a bartering plan, the therapist should consider the same factors, among others, mentioned earlier: the client's and therapist's cultures, history, age, gender, health, economic class, and mental state, whether the setting is private or group practice, or if the patient is inpatient versus outpatient, and the modality, longevity, and intensity of therapy. In general, there are 5 moral principles which guide the ethical decision-making process. These include autonomy, non-maleficence, beneficence, justice, and fidelity. Michael Gottlieb et al. Designed a decision-making model based on several assumptions. The model is for all professionals. Not all dual relationships are avoidable. All added relationships should be evaluated further. Not all dual relationships are exploitive. The model is used for recommending actions, and that it will not work for existing dual relationships. Gottlieb's model is based on 3 dimensions: power, duration, and termination. Power refers to the level of power the therapist has over the client. Duration is important as power increases over time, and termination references how long this relationship will last and if there is no end date. When contemplating a dual relationship, the professional should assess the 3 dimensions above. Youngren and Gottlieb expanded this model to include questions such as: 1. Whether entering into a dual relationship necessary? 2. Could the dual relationship cause harm to the client? 3. Would the dual relationship prove beneficial? 4. Could the dual relationship disrupt the therapeutic alliance? 5. Can this matter be objectively evaluated? Zer and Lazarus provided a similar, yet simpler, decision-making model based on the client's needs, the setting, and whether the dual relationship is likely to be helpful, harmful, or inconsequential. Psychological professionals need to take a new approach to the accepted risk management method. The current system is more about protecting the therapist than it is about helping the client. A do-no-harm type approach compromises the use of many clinical and therapeutic techniques which could be used in the best interest of the client. Instead, clinicians still focus on themselves. When it comes to bartering, there is an emphasis on the risks as opposed to the benefits. In many cases, manufacturing a short-term, or long-term, bartering plan is what is best for the client. Avoiding risk by refusing alternative arrangements such as bartering can cause harm to past, present, or future clients. Inaction can be just as damaging as engaging in the wrong action. If a therapist takes the time to properly map the possible outcomes of a bartering arrangement, or dual relationship, thoroughly discusses these possibilities with the client, and constructs a well-laid-out plan which is signed by the therapist and client, then there is very little risk in this practice. Risk management should not interfere with alternative methods to help a client. Clinicians often tell clients that their actions will rarely be ideal or perfect, yet, they have this unrealistic expectation for themselves. Professionals are not judged by their actions, but by their reasoning for these actions. If someone has taken the time to properly assess the situation and has picked an alternative arrangement which is clearly the best route for the client, the therapist has taken the right action. If, while assessing the action, it is determined that the method is not working out as planned, one can reassess with input from the client to determine a new course for therapy. All in all, regardless of the form of payment, clients go to psychological professionals to get help in growing and healing, not to have someone practice risk management with them. Therapists must utilize every resources they can to strengthen their client and community. This includes bartering,